I have a pretty good theory in my mind as to why I think I have had the reproductive health experiences I've had.
Yeah.
I got my first period around age 12 or 13, and I was feeling birth control pretty much within the same year as that. I just remember
Yeah.
my periods being very irregular and very uncomfortable and painful, and I would have to skip school and I would get diarrhea and it was bad. And I used Yaz the very first time. Those were the, oral contraceptive pills. And I just remember it making me feel crazy. That's the word I used. It
Yeah.
made me feel like emotionally not myself. And so then you play that game of, well, which one can you tolerate the best? Which one do you hate the least? And you try all of the different methods. So I think I've tried over 7 different methods. So I've had the Nexplanon, I've had the pills, I did the NuvaRing. I tried to have an IUD inserted. I had an IUD expelled during my insertion procedure, which is apparently a very rare experience. Knowing what I know now, that puberty takes a few years to establish, I obviously
Hmm.
think that my cycles maybe would have, worked themselves out had I known how to support them back then.
Welcome to the Cyclical Doula podcast. I'm Emma, a certified fertility awareness educator, miscarriage doula, and the founder of Emma LLC. This space is for women who want to understand their bodies deeply, not just memorize information, but actually feel confident in interpreting their cycles. Here, we talk about ovulation, hormones, cervical mucus, basal body temperature, and all that messy in between emotional layers that come with being a woman. We talk about trying to conceive, avoiding pregnancy without hormones, postpartum transitions, pregnancy loss, perimenopause, and everything in between. Because body literacy isn't just about charting. It's about the autonomy. It's about informed consent. It's about not outsourcing your reproductive decisions to guesswork or fear. Each week, you'll hear conversations with women's health professionals, birth workers, educators, and researchers, along with solo episodes where I teach practical skills you can apply to your own cycle right away. If you have ever felt like you should have learned this information sooner, if you have ever felt disconnected from your cycle, if you want to raise the next generation without shame around their bodies, you are in the right place. So grab your tea, open up your notes app, and let's build cycle confidence together.
Welcome to the space where cycles breathe, where the real raw life of a mama leads, from motherhood's highs to charting the low. Your body's story is the star of the show.
Hey, welcome back to the Cyclical Doula podcast. I'm so excited to be sitting down with Kourtney today. She is a reproductive health professional, a femme teacher, and someone whose own journey through anovulatory PCOS and infertility completely reshaped how she understands the body. Kourtney brings both lived experience and clinical perspective to this conversation today. And I am so excited to be talking about all the different things. So thanks so much for being here.
Yeah, thanks so much for having me. I'm excited to share. I'm excited to be here.
Yeah. I think we met in person at a FACS conference a
That's
couple years
right.
ago. Honestly, I was trying to think before we started recording, like how long ago it actually was.
Yeah,
I think it was like 2 years ago, but maybe it was
I
more than
think
that.
it was 2023. I think it was
Okay,
2023, so
that
about 3
totally could be
years.
right.
Yeah,
So
that
three
sounds
years.
right.
Yeah. And it's just so nice to have other people who like are in the profession and be able to like get to know each other a little bit more. But again, I'm so excited to chat with you today and talk about all the things that you do.
Yeah, I think truly that conference was the first time that I felt like I was in a room of professionals that were similar to me. So it was really
Yeah.
nice just getting to connect and have that ease. Like that was a baseline for everyone that we all just knew the same information about fertility or fertility awareness methods. And so it made so many connections so much easier. So I'm just really excited to have found you. I think you're awesome. I love
Yeah.
what you're doing. So this is super fun.
Well, thank you. Yes, same. Um, all right, let's start. Let's just start by you telling people a little bit more about who you are, whatever you want to share about who you are as a human being.
Guess that I just would want to share. I've always been interested in reproductive health since I was like a little kid. I always found it so fascinating and really connected with the fact that I had a mom's body. Like I just thought that was the neatest thing ever that I could have a body that could make babies, and really had that fascination from little up and watch all of those TV shows about pregnancy and birth. And I don't know if you remember those, like TLC, all of the all of the like
Yeah, for
docu-series.
sure.
Yeah. It was just those were so fascinating to me, like any kind of movies or books that had pregnancy and birth in it. So I just from very young was thought it was so cool. Thought it was just the most interesting thing. Um, so that kind of was just the fascination of I want to learn a lot about this. And then obviously you grow up, right? Like you go through puberty and you get married and then you want to have babies and you kind of go through all these different experiences. And I was on birth control for like such a long time. It's about 10 years. And so when I came off of birth control in order to have children, that's when I really started to learn everything I thought I knew was pretty much wrong. And so I really just dove right in because I had so much interest in it in the past. And I was like, well, all right. I had gone to school for it. So I have my bachelor's degree in public and community health education and really focused on sex ed and took every like elective I could. So I've just always been a really passionate person in this space in reproductive health because I think it impacts every single part of our lives. So I think if I had to sum myself up, uh, outside of what I do for work, it's just that I'm a really passionate educator. And I think that these topics are things that women need to know about at really vulnerable points in life. And I like being a person who's a part of that.
Yeah, that's amazing. I love that so much. So you talk a lot, or you've shared before on Instagram and like in other places that um, you've had this interest from being really little about just like the reproductive system and like bodies in general. And I think like you've even mentioned before, like it was a little bit of like rebellious, like trying to like find it in that way. I also know that you are a parent. So like do you feel like that's influencing I know your kids are little, but, like, does that influence how you're gonna talk to them about their bodies and, like, their possible future reproductive choices?
Yeah, I think it makes a huge impact on how I'm gonna speak to my kids about it. I think it gives me such a bonus, honestly, to
Yeah.
have so much not only factual knowledge, but then practice having the conversations with so many people. I think that's the part that parents tend to leave out. I think that they think it's the talk or one conversation, and it's really just about teaching them about their bodies from the time that they're little, what's appropriate, what's not, what stays in private, what can we do in public, like just all the different things about body safety, and then also encouraging healthy and responsible choices as they grow up and helping them understand what changes they're going to experience and how it's normal, and then just trying to be a guide. So I think my act of rebellion in learning it was because the grown-ups weren't talking about it, or it wasn't appropriate for kids to learn about their bodies because it was considered sexual, which I can understand. I get the fear. And as someone who does sex education in schools, I understand why parents might feel uncomfortable with the conversation or how they could feel it might impact a young person's attitude or choice to do something. But the reality is we're probably all going to end up sexually active at some point. So I think that we also need to just keep that reality in mind and be the ones to give our kids or equip our kids with appropriate knowledge that we want them to have from our perspective. Because if you're not going to teach it, somebody else is going to, where they're going to have absolutely no guidance.
Yeah, I love that. I agree completely, but it's it's so nice to have other people who are in those same spaces and like especially your experience with like teaching this to in other spaces and teaching sex ed, like that's really helpful to just like hear. And I think that that's something that a lot of times like it just isn't it's not talked about and therefore like it becomes this taboo topic in general and that makes it hard for sure. Um, so tell everybody, so you do a lot of different things, but one of the ways that we connected is that you teach a fertility awareness based method called FEM. And so I would love to know like what you want to share. And obviously I know it's a long story. So feel free to share whatever you want to and talk for however long you want about how you got to that place of teaching FEM.
Yeah. So like I said, I was always interested in sex ed from a very young age. About third grade is the first time I remember wanting to research it as a topic. And so I always had known that that's kind of the direction I wanted to take career-wise from that age as well. And so when I went to college, I did a bachelor's degree in community and public health ed. And then at that point, that was the first time I'd actually ever learned that there were phases to the cycle, was when I was 19, like a sophomore, I think, in college. And I was like, wait a second, I am like the sex educator of all of my friends. I'm the one who tells everyone about all their birth control and period products and all of the things and like tries to encourage them. And I don't even know what the cycle is. So that was a big moment, I remember. And so then I was on birth control at that time. I'd been on birth control for many, many. I had been with my now husband. We have been together since we were like 12 and 13, about eighth grade. So we had always been very safe, too safe, we've learned maybe, because then we ended up struggling with infertility for like 3 years. And that's when I took it upon myself to just combine my passion that I'd always had for the interest in the topic with my lived experience to just be like, you know what, I'm going to share about it. So I just like kind of took to social media and made it a little bit of my lived journal to a degree and was like, hey, this is what I'm going through. And I think nobody knows anything about their bodies until they get off birth control and are trying to figure it out on their own.
Mhm.
So for me, I didn't even want to learn fertility awareness. I didn't want to do FEM to begin with. I actually was like, I don't want to be as involved as cervical mucus. That seems like too much. But I spent like $300 on a femtech device that I can't even use now. That, like, it's not it's a I could have spent $10 and gotten the same thing. It's just a thermometer.
Oh.
But that was, I call it like my gateway drug to fertility awareness, was femtech. So like thinking a device is gonna know my body better than myself. Um,
Mhm.
so I remember buying that device and being like, "Oh, let me see." But then I was so confused because my body wasn't I was not ovulating. I did not ovulate off of birth control for 9 months the first time, or, I think I was seeing a breakthrough bleed, honestly. But it took me, after birth control, it took me 9 months to have my first bleed, and the device was not made for that kind of cycle, so nothing was being explained to me, and so I needed to learn a lot really quickly so that I could stop panicking. And I think that's a really common experience, especially with women who are heading into that trying to conceive journey. That panic sets in really fast. That
Mhm.
expectation of getting pregnant so easy, and then when it doesn't come to fruition right away, causes so much shame and anxiety and panic for women. So that's then how I decided to start actually wanting to chart, was because I was teaching so many women about their bodies via social media, answering period questions, answering cycle questions, talking about my infertility, talking about their, pregnancy stories, journeys, losses, all of those things. And I was like, well, I want to be more legit, to
Yeah.
teach the thing that I'm learning, that I'm finding so much value in. Um, so I definitely feel like it is a journey that you don't take by chance. I don't think you accidentally learn about your body. I think usually you
Yeah.
have some sort of struggle that jumpstarts your learning, and that, could be a really great thing, honestly. So it was fertility awareness once I wanted to get certified. I think it was about 2020. I'm right at the height of COVID. So I had just gotten my job as a first time, finally, using my degree, sex educator, in February of 2020. And then obviously in March of 2020 was when the national shutdown happened in 2020. So I was sent home. I was furloughed from my full-time job. I was like so excited to finally be a sex educator. I was hired to do HIV testing in the community, and do like rapid HIV testing and screenings and education on how to reduce risks of STDs, pregnancy prevention, all that fun stuff. And got sent home from it. I was so bummed. And I was like, well, you know what? I think from home like 20 hours a week. Might as well do my FEM certification. So invested in that process, started it. I was really overwhelmed by the schooling. I felt like a really, really, really smart cycle educator by the time I took that course, and it was still very challenging. So it is not for anyone. If anyone has any kind of fertility awareness educator or instructor certification, they have been through it when it comes to getting their charts analyzed and really thinking very critically about what someone's chart says. So that was just the coolest experience, but it was very overwhelming to finish that certification at the same time as going through infertility. So helping women get pregnant with charting when I couldn't even succeed at that myself was very, very, very challenging. So I took a pause from the schooling and did not graduate with my certification straight through. I didn't finish it right away. And then I got pregnant, first trimester. That'll take the life out of you. So definitely needed to keep the paused at that time. And then I ended up having a baby at 29 weeks. I had an eclamptic seizure and had to have an emergency section. She was 29 weeks and 2 days. So that was then my entry to motherhood. And then NICU land we did for 75 days. And then I always say when it comes to like birth trauma and mental health and postpartum in that first round, I don't think I felt clear until about 18 months postpartum.
Mm-hmm.
The fog was finally starting to lift. So then once I was back in my, my sex educator role that I was in, I was doing a little more with Title 10 related work, which is federal reproductive health funded programs. So I was doing more grant related admin work, budgeting, data reporting kind of stuff, which is super fun for me. And I was like, you know what? Maybe I should finally finish my certification because that's when I discovered that Title 10 is supportive of fertility awareness methods. It's one of the eligible contraceptives that we should be educating all people in the country about when they come in and talk to their doctor about birth control. And I know no one is doing it. So I was like, hey, boss, I was getting my fertility awareness certification. Do you think we can use that here at our clinic? And they were like, go for it. So basically started up my own entire service line at our OBGYN clinic and don't see a lot of people. I think I've had about 75 referrals in the 2 years I've been doing it. And forget to pull up the statistics, maybe I think most of them come to me wanting to conceive and just don't really have any idea of ovulation. They're using an app. They're frustrated. Maybe nobody's even ever looked at their partner and voila, it's a little bit of both. So there's a lot for people to learn, and I've always enjoyed getting to be the person to help kind of break the mystery of
Yeah,
reproduction.
that's so good. I love that so much. I feel like there's so many things about your story, and I know there's more to it, but that's a good good part of it. Did you have anything else you want to share before I talk more?
I think just with that lived experience I have, I've now been able to. So I had my first baby with not assisted reproductive technology, but with a NaPro approach, a NaPro office. So after 3 months of, well, I had charted my own way through my own health problems. I discovered hypothyroidism for myself and ovulatory cycles. Took me a good long time to find a doctor who was supportive of what I thought was happening and would appropriately test and treat. But once I found the right doctor, I was pregnant within 3 months, and that was great. That was super exciting.
Yeah.
And then with the eclampsia, that lived experience has given me some really cool opportunities. So I sit on our state's maternal mortality review committee. So we go through every maternal death that happens during or within 1 year of a pregnancy's end. So in that perinatal period, and review that case for cause of death, contributing factors, and then our committee writes legislative recommendations to our state to try and get payers or insurance companies or healthcare systems to increase safety for moms and babies that might be in a situation where maternal mortality might be likely. So that's a really interesting table that I enjoy being.
Yeah. It's like such a whole nother like it's obviously all related, but it's a whole nother topic and it's such an important thing to be happening because I think that's something that again, like it's not something that we talk about a lot. And like you mentioned, like it's a whole year after birth that they're looking at this. And that's like that alone is an important factor for I think a lot of these conversations to be taking place.
Yeah, absolutely. I think postpartum is really forgotten. about, and that's really a risky time for so many moms, and their
For sure.
families and their support systems just don't even know what to do. So it's just there's so much education that's needed, and I really think that the way we decrease maternal mortality is to increase reproductive health education. I think if we were teaching young people from the jump, here's how your reproductive system works, here's how to keep it healthy, here's how you know if it's not, then we would have healthier pregnancies, healthier offspring, and then just ultimately healthier outcomes for most people. That's just that would be root cause approach for me for maternal
Yeah.
public health.
For sure, and I think, like, you have the background to have that opinion strongly, right? Like, you've seen it in a lot of different ways, and I think that's great. I think, like, yeah, getting to those points where you can really make change versus just kind of hitting like, covering up symptoms in all ranges really allows for change to happen as much as it can at the root, which is really important, especially with, mortality and all of those things, especially with reproductive health in general, because it's something that still feels, I feel like, taboo in our society, and it really shouldn't be. It's just part of our life, and I think there's a good boundary between like education on reproductive health and also like sexual health, and then also like sexualizing everything, right? Like those are two very different
Different.
things. There can and that's I think that's a hard differentiation for a lot of people to make.
Especially for a lot of people
Um
who don't have any foundational education to even get that
mhm.
differentiation. Yeah, it's all same
Yeah,
to them.
for
It's all
sure.
just sexualized, and just that means inappropriate, or
Yeah.
just not true. You can get
Mhm.
reproductive-based cancers. We should talk about it. Like,
Yeah.
you want the cigarettes to have the warning on it, right? So your 18-year-old, when they decide to buy them, can be warned, right? So, like, you should also be, I don't know, put something on condoms about STIs, or, just
Mm.
some sort of
Yeah.
awareness, because they really are on the rise, and people aren't sure of the
Yeah.
behaviors that cause it. A circumstance that they didn't think that you would have the power to not be in, but all it would have taken was someone having a frank conversation, someone who's educated saying, "Well, no, that's not exactly right. Here's what we do know. Here's what we can do. Here's how you can have a healthy sex life for a long time if you so choose." And I think that that's just a really big part of life that we're missing. And then that
Mhm.
all trickles down into all the other things I think that sex ed touches: healthy relationships, consent, any kind of past trauma, communication skills, boundary setting, family planning and future goal setting, because it's a
Mhm.
really big deal if you have babies before or when you didn't want to, like, that's a really
Yeah.
big thing to go through. So having a plan and then behaving in a way that aligns with your plan is a conversation people don't think through or don't have intention behind a lot of times. And I think that that's a big miss on reproductive.
Yeah, and I think there's a lot of conversation, and I think we kinda mentioned this earlier too, of just, like, if you tell kids all of these things, like, they're gonna make there's fear around they're gonna make choices that would either, like, go against their morals or, like, go against, or, like, get them into bad situations to begin with, and I think sometimes we don't give kids enough credit that sometimes when they have all the information that they're like, "Oh, yeah, no, like, not right now."
They see the
And I
gravity. Yeah, I think when
yeah,
they
and it
recognize some of the weights of it, or because you don't know what you don't know. That's what I always love to say.
yeah, right.
You don't know what you don't know. Ignorance is bliss. You think everything's fine because you don't know any different, and that's how a lot of people go through the world, in existence. And
Yeah,
I just think that winging your family planning or your sexual health is really not a good method. So,
for sure.
basic education. I like to say that I am like sex ed, college level sex ed for grown-ups, because that's what I like to do, because we just don't have sex ed.
Yeah, right, and I think, like, there's so many layers to that, like you were just mentioning, like, it's, like, not only, like, physical, like, what is taking place, and then also, like, what are we looking for health benefits. And then also like, how do we physically do family planning? And a lot of people don't always realize that like that's both trying to get pregnant and also avoiding pregnancy and like all of those things. It's all of that accompanying versus many of us were taught in sex ed like use a condom and then but also like don't have sex because you'll get pregnant because like any day, anytime, all the
The
time,
time,
forever and
every
ever,
time.
which like is not, and then you'll die like in
Yeah,
a year
yeah,
or
yeah.
else, right? Like it's just like, I like, it's one of those things where it's just like, that's obviously like not helpful. Um, and there's so much that can be
So much wrong with that.
changed about that. But when you do, again, like when you don't know, you don't know. And like how until we start having these conversations and still until there's people like you who are having these conversations broadly, like we just don't know.
Yeah.
Yeah.
And there's still a lot of folks who don't want folks like me to have a professional role, have a professional opportunity to even have these conversations with young people. But I'll tell you what, when your teenager has an STI or when your teenager ends up pregnant, you're going to have big feelings about it. So these things are
Mm,
preventable with a
yeah.
good conversationalist on what are these things and how do we make decisions that we can be okay with in the long run that align with all of the things you said, right? Our morals, our values, our goals, our health. Do we even know our own health history, right? Like
Yeah.
there's
That's huge.
so much health literacy missing in the general public. So to get into something so specific as reproductive health is very specialized as well. So I just think there's so much talk that needs to be happening regarding basics of health, especially in a country where we don't have basic health care, we don't have national healthcare coverage. People really have no idea how the insurance system works. I think that's another interesting element that I bring is I've worked in the medical system my entire adult career, almost 10 years now, and have a lot of experience in like the billing side of things or appointment scheduling. And now I get to see patients clinically and provide fertility education and I get to do administrative budgety type things. So I've seen it from so many angles and there's just no space for you to not understand the medical care system. You will
Mm,
get mowed over. You will get bulldozed down. You will not get any better, in my opinion, because it's too stressful to even engage with. I think
yeah.
that's the case for a lot of people. They're afraid of the cost. They're afraid of what might come true, what might be true of their health. And I think that a lot of us make decisions based on fear around our health and our
Hmm.
bodies.
Yeah, for sure. Hey, I'm just popping in real quick to say make sure you're subscribed to the Cyclical Doula podcast on whichever platform you're listening to, and don't miss upcoming conversations. If this episode is resonating with you, please share it with a friend, rate it, and write a review. This is how this movement grows, not through algorithms, but through women talking to women. All right, let's jump back into it. You mentioned you kind of briefly went over it. Obviously, I know about it, but maybe not everybody does. You briefly mentioned your experience going to a Napro doctor to help get a little bit more information about what was going on with your body when you were having anovulatory cycles. Is that something that you're willing to share more about, like what that looked like for you, or just like explain what Napro is otherwise?
Yeah, I would love to. So NaproTechnology stands for Natural Procreative Technology. It's a branch of OBGYN or reproductive health where the surgeons are specifically trained under different protocols to do more restorative surgery, so more prevention of further adhesions or prevention of further disease for like endometriosis excision. I myself did not have endometriosis, thankfully, but worked with an expert endometriosis excision surgeon. Dr. Naomi Whitaker is her name, and you can find her on Instagram at Napro Fertility Surgeon. She's my doctor. She delivered my last baby, and I'm so thankful for her. And it was super cool getting to be under her care for my second pregnancy. It was a very full circle moment for me. So, yeah, like I said, I struggled with infertility. After I got off birth control, I didn't get my periods back for 9 months, the first bleed, and then 9 months again for the second bleed. So there was 18 months of my trying to conceive journey. So I thought where
Yeah.
it really was all pointless. I
Yeah,
mean, it
for
was a lot of
sure.
fun, but it was definitely something that we look back on like, oh, if we had known better, we would have gotten help much sooner. But
Mhm.
yeah, struggling for about 3 years in total. I remember to a primary care physician for some thyroid health. My husband and I had just moved and needed to reestablish with a primary doctor. And at that point, I had gone into that appointment pretty much prepared for a referral to a reproductive endocrinologist, which is not what I wanted. I had never been someone who was interested in IVF, and it wasn't even from any kind of values perspective. It was so truly from never wanting to give myself shots. I knew from watching so many fertility
Yeah.
journeys. I hated needles. I used to pass out getting blood work done. I was like, there's no way I can give myself shots. So if I can't have babies, like I can't do IVF. There's just no, like, I'm not.
Mhm.
So I always say you make plans and God laughs. So I'll come back to daily shots. But,
Yeah.
um, so I was going to a new PCP for thyroid testing, and I went to this appointment, and I'll never forget. This woman was so dismissive. She barely wanted to talk to me about anything. She had no idea at this point that I was even a fertility educator, a sex educator. It was her first time meeting me. She had no idea who I was, what I did, nothing about me. She said about my thyroid labs, she would probably just run TSH. And I was like, can't you run TSH and T3 or reverse T3? And she was like, well, why would I need to do those? And I was like, well, the type of medication I'm on, usually that's the labs we test because sometimes they talk about wanting to put me on a combination thyroid medication. And she was like, no, that's not what you need. This is sufficient, blah, blah, blah. You'll probably be a high risk pregnancy at some point anyway because you have a thyroid problem. You'll probably need to see maternal fetal med. Just have fun. When your cervical mucus is creamy, that's the time to do it. And I was like sitting there in my head, like, she's so wrong. She's so wrong. She's so wrong. I told her I'm anovulatory. She told me that that was not possible. She said, if you're bleeding, you're ovulating. And I was like, wow,
Yeah, that's wrong.
please read a book. So I left that appointment just
Maybe a quick Google search.
even something. Come on. So I was very unhappy. I remember leaving that appointment sobbing, and I was like, screw it. I'm gonna schedule an appointment with that doctor that I just found, which was Dr. Naomi Whitaker's office. Got into there very quickly compared to how long people wait to get into her now.
Their wait list is so long.
Like years. I got in, I think, in like 3 months. It was insane. So it was all of these things were like, again, very big God winks for me. She's
Mhm.
like 15 minutes from my house that we had just moved to for my new sex ed job. It just all lined up really well. So yeah, I think I was there. The first appointment I went to, they were like, well, what do you want to talk about? And I was like, well, I'm pretty sure I'm having anovulatory cycles. I'm pretty sure my thyroid is not managed correctly. I think I have PCOS. And they were like, yeah, that seems pretty accurate. Pretty mild case. We can
Yeah.
treat you with this and this. We can do, they gave me like 3 options. So lowest intervention, diet, lifestyle, vitamins, healthy habits, right? Then middle tier was we can offer ovulation induction medication and progesterone, cyclical progesterone to induce bleeding and then try to force you to ovulate so that you can kind of try to time your intercourse according to the medication cycle. And I was like, okay. And then the third option was something called an ovarian wedge resection, which is what they at that point had described to me as the closest thing to a cure for PCOS that we have, which is basically your ovary shaped, let's say like an almond. They go away, they cut a wedge pie piece out of it, stitch that ovary back together, and that healing, that stitching rejuvenates or re encourages cells or follicles to grow, mature, and that can restore ovulation for women who have had chronic and ovulatory PCOS cycles. So I was not down for surgery. I did put my name on the wait list in hopes that I would not need it, and I did not. And I'm very thankful for that. At that point, I think after my very first visit, I was like, well, let's just do like your workup labs and do watch and wait or lifestyle and vitamins while we figure out what is going on. Well, after a month or 2 of that, I was like, let's do the middle one. Let's ramp this up because it had already been so long. And I had asked, I was like, do you think like 3 to 6 months of ovulation induction meds would be the ticket? And my provider was very positive. She was very hopeful. She was like, from what I can tell of your case at this point, I don't see why that would be unreasonable. She was like, is it to say for sure that could happen, you're gonna be pregnant, I don't know. She was like, "But I don't see why you couldn't be." And I was like, "Oh, okay." And so I had done one Clomid cycle with a previous OBGYN, when I had first gotten off my birth control. I had done one Clomid cycle that did not end up in pregnancy, and then I think I did a second Clomid cycle with Napro. Oh, I'm gonna have to look back at my notes. You know what? From these appointments. But I know I did 3 total medicated cycles, and one of them for sure was tamoxifen, and tamoxifen is the medication that I ended up conceiving my daughter on. Yeah, after my first NaproTechnology appointment with their office and feeling the most hurt I'd ever felt in 3 years of struggling with all the things related to my cycles, I was able to conceive. And then used fertility awareness postpartum, and then was able to conceive completely naturally with no intervention for my second pregnancy. Then Dr. Whitaker was my C-section surgeon for my second baby. So it was a super awesome, full circle moment.
Yeah, that's so good. I love that. So um I'm curious about your opinion about if you think your experience with birth control, obviously, like, you have PCOS, like, that's an experience for you and a diagnosis or whatever. But do you think your influence of being on birth control changed that timeline of, like, your body trying to figure stuff out coming off of it before, or do you think it was all the other stuff too? Obviously, like, it's kinda hard to know for sure sometimes, but
So I have a pretty good theory in my mind as to why I think I have had the reproductive health experiences I've had.
yeah,
I got my first period around age 12 or 13, and I was put on birth control pretty much within the same year as that. I just remember
yeah,
my periods being very irregular and very uncomfortable and painful, and I would have to skip school and I would get diarrhea, and it was bad, and my mom's were always so bad, so it was just like, "This is what being a girl is." And it was
yeah,
awful, and I remember going to my pediatrician at that time, and she was like, "You're so young, I really don't wanna put you on birth control, but I don't really know what else to do." Like I said, my husband and I have been together since we were 12 and 13, so I also was at that age of, like, crushes and starting to like boys and did become sexually active as a young person, so there was that element of, "Oh, birth control might not be a bad idea to get used
yeah,
to,"
yeah,
going into teenage years, so I was down to use it, and I used Yaz the very first time, and those were the, oral contraceptive pills. And I just remember it making me feel crazy. That's the word I used. It
yeah,
made me feel like emotionally not myself. And so then you play that game of, well, which one can you tolerate the best? Which one do you hate the least? And you try all of the different methods. So I think I've tried over 7 different methods. So I've had the Nexplanon, I've had the pills, I did the NuvaRing. I tried to have an IUD inserted. I had an IUD expelled during my insertion procedure, which was apparently a very rare experience. So that was really fun. And yeah, I've just tried lots of things. And so I think, yeah, knowing what I know now, that puberty takes a few years to establish, I obviously
mhm,
think that my cycles maybe would have, worked themselves out had I known how to support them back then, but nobody knew how to support them back then. So it was just
for sure.
contraception was the answer. So did that for all the way through college. And it wasn't until after I got married, I had decided that we would be comfortable with pregnancy at that point, that it was like, well, okay, well, how soon can I come off of this? How soon should I come off of it? Because I really didn't want to come off and get pregnant right away, which can happen,
Yeah,
absolutely, and is the
for
experience of
sure.
many people. But I was like, I kind of, don't feel super well. I was having migraines all of the time at that point. I was on the Nexplanon at that point. I really do feel, this is just me speaking, but I really do feel like had I not come off my Nexplanon early, my understanding is that those migraines, especially migraines with aura and consistently and being on combination birth control for so long, I really think my stroke risk is probably super high and not
Mm,
something my physicians were and trying to say to me or were even
yeah,
on their
yeah,
radar. And knowing that I ended up then with eclampsia in my first pregnancy, and then I ended up with a DVT, I had a blood clot after that. I think my risks for stroke were probably really, really high. So yeah, I think that the birth control I think I just stopped puberty before it finished. You know what I mean? So I think
Yeah.
that when I
Yep.
then came off of it, I didn't understand reproductive biology still. And so then I was like,
Yeah.
where are my periods? Where are my ovations? How can I get pregnant? It's like, oh, you're basically going through puberty all over again, which is now what I specialize in and
Yeah.
helping other women is the return of fertility. So that's PCOS, coming off of birth control cycles, postpartum cycles, or just infertility in general, like trying to get those ovulations back. How do we support what needs supported to get ovulation back? And yeah, I think I always say I'm so grateful for birth control because I got to plan when to have my children,
Yeah.
but I'll probably never use it again if I don't have to.
Yeah, absolutely. And I think that's such a it's a great perspective to be able to share, and I know that that's not everybody's experience. So, and I like there is a reason that it's out there. So I like don't want. I know you feel similarly as like it's helpful for certain people in certain seasons of life. So I don't like want to discredit that at all. But it is really, I think it's a good reminder, especially as parents, that like putting your kids on birth control right away is not going to solve any of their problems long term. Like, yeah, it can help with symptoms to like manage to get to another stage that you can get more support or the right people or like all of those things.
Yeah.
But I think that's really helpful. And I think like if you're listening to this as somebody who's grown up and like this was your experience and you're stuck in this time of like, I'm not getting pregnant and I don't know what's taking place, like that might be something to consider of like your body might just be trying to figure itself back out. And obviously there's all sorts of other situations that you can do to help that. But I think that's really helpful to just kind of hear.
I think that we need to start with approaching the healing elements from basic
Yeah,
lifestyle. I think we've all forgotten
for
the
sure.
basic lifestyle things. Something as simple as walking, something as simple as staying hydrated or getting sunshine. Those are so
Yeah.
basic, and so many young women or teenage girls are not getting that. And so think you have all of us as, 30 heading into our 40s moms who are now learning, oh crap, infertility. Oh crap, here's what I didn't know. And then we're having daughters and we're like, I need her to know different. And that's a really big
Hmm.
shift for so many people. And we just didn't have that. Our moms didn't have access to the information like we do. They
Of course
probably
not. Yeah.
didn't have the same kind of community conversations like we do now. I do think that comes from a little bit of our generation being like hypersexualized a bit. Like we're okay
A little
having those
bit.
conversations about these things pretty openly because all of us are not afraid to admit it's just a fact of life. So whether it's comfortable or not for everyone, that's one thing, but it's very much real to everyone. And I think that nobody's doubting that sex ed is important. It's more so just like how do we make it important? How do we influence society in a healthful way forward with open conversation? Yeah, I think as
Yeah.
as a mom, whatever your puberty journey was, and then whatever your motherhood journey was, no matter what, I think at some point you're gonna need to know this stuff because you're gonna have
Yeah.
kids and they're gonna have questions, and you deserve to understand your own body because you're the one that cares about it more than anybody else ever could.
Yeah. For sure. Absolutely. 100%. No notes. Um, I feel like I want to pick your brain a little bit about fem a little bit more if you're willing to talk about like what you love about fem teaching it and like seeing how that's establishing with the way that people are charting.
Yeah, so FEM stands for Fertility Education and Medical Management. So it's a program that you can use to chart your cycle. It's an objective charting method. And so what FEM does is it utilizes cervical mucus as well as LH testing or at-home urinary testing to determine where you're at in your cycle each day. So you have to track these biomarkers daily, and then you work with an instructor to ensure that your cycle patterns are falling within the normal of a healthy optimal cycle. So one of the things that I love the most about FEM is it's a color code. I don't know what's so good about a color code, but I really just most of myself and most of my clients were all type A ladies. We love things to be organized. We love a system. A chart is just such a lovely place to put so much information about your day-to-day life down that most type A women love this. So for me, it's the color code. We only have truly only have three options for your cervical mucus, which I think that makes it very simple to choose from. It doesn't get super overwhelming. I know that, again, most people tend to overthink it, but I love that there is just 3 basic. Is it 1, 2, or 3? Is it this, or this? And then just taking good notes. So that's one thing I really love about Fem. And what I also love is there's a free app. So I know everybody wants a period app these days. Everybody's also getting concerned about data and what's private, what's not. So if you're using the flows and the clues and the period tracker things, please try to use something different. I really love Fem as a free app. You would have to be utilizing the Fem method or some sort of awareness of mucus in your bleeding. Or the Read Your Body app is also another one of my faves. That one is more customizable, but again, is built for charters by charters. So it is going to very much have like that charting lingo. None of these apps are going to predict your next bleed is coming at such and such a time. And that's what I tell people. That's what you want. You don't want something predictive. You want to make sure you're using something that just lets you put in data. It's for you to
Hmm.
decide what's happening and why
Yeah.
and when.
Absolutely. That's so good. I'm a huge advocate for the Read Your Body app too. I call it like a paper app on steroids, right? It's just like you already carry your phone around, you just put it in there. And I know the Fit app is similar, but just a little plug for Read Your Body is that they recently like released templates, but they also released one like a template or a form of it that's just for period tracking. So
Yeah.
if you are listening and you do have a daughter or you're in a season of life that you like only want to be tracking when you're bleeding, it now like can be set up so that's really all you see and that's all you can chart, which I think is like really helpful because
Really great beginner
sometimes we
step.
don't want to see. Oh yeah, it's a great starting point. You can track your mood and all of those, whatever else you want
Yeah.
with all their emojis and stuff. But yeah, 100%. I love that. And I think like it's so cool to be able to see how all there's so many different methods and organizations out there that pull from different biomarkers, but they all get to the same root of like you are just like understanding your body really well with these different biomarkers, and like here are the tools to make sure that you know how to do this well, and like here's some other resources about like things to look at and other health markers and all of that stuff. But I think that's like one of the really like the my favorite part about fertility awareness based methods is that like it's not a right or a wrong method. It's about like which one somebody's going to use and which one they feel comfortable with. And like you said, like Fem has fun colors and like if that's going to make you use a method well, like then that's the one that somebody should choose. And like that's 100% I'm all for stuff like that.
Yeah, you definitely have to choose the thing that you're going to actually practice well. It's the same if you're
Yeah.
choosing a hormonal method versus a non-hormonal method or a fertility awareness method. You have to know what your behaviors are like. You have to know if you are someone who can stick to the behavior needed for the effectiveness or efficacy of the method you choose. All of these things have to be talked about between you and your partners, to figure out what makes the most sense for what you're comfortable with. So I definitely feel like with charting, there are so many methods, and I think people get overwhelmed when they learn that as well. And I'm like, well,
Yeah.
you just have to try. Like we all start somewhere. We all started
Hmm.
birth control with one random thing, and it might not have worked perfectly the first time. Why do we expect learning how to
Yeah.
chart being this perfect thing that we have to know how to do amazingly and 100% correct? There's wiggle room and there's learning and there's support. I mean, that's what people forget is you have people who want to guide you through it because most of us did it by ourselves.
Yep.
And having that sounding board, having those extra eyes and that logical brain stepping in when you're probably sitting in your emotional space can be so
Yeah.
grounding and so helpful. And it's just education. It's just learning. Like you can't be too hard on yourself. You just have to start somewhere. And usually for me, whether that's like a period tracking app, like using Read Your Body for just the period tracking, I always think everyone should read Taking Charge of Your Fertility. That is the fertility awareness Bible to me. That is like the book that if you just don't know how the women's reproductive system is made, this will help you understand. And it will help you understand pretty much every fertility awareness method to at the root, like you said, at the root, they all tend to use the same markers of the body. It's just how to write them down or how to categorize them or what term you might use for something. So again, that's all up to the charter themselves, but we all start somewhere. Learning is all we can do to start.
Absolutely. So good. What else do you want to share with people who are listening?
I think that my favorite part about going through all of the experiences you can go through as a woman or someone who becomes a mom is just the development that comes with that, the character arc that comes with that. And I think that when we start these conversations, one of my favorite things to think back on is like middle school, like when we were all starting to get our periods for the first time, right? Girls talk. We talk. We're in the bathrooms, we're chatting. We're in the locker room, we're chatting. We're at the lunch table, we're talking. Like we are sharing details of our lives and asking each other questions because we build community that way. Telling stories, sharing vulnerable things. And so I think that when you then go through infertility or pregnancy loss or something really intimate and vulnerable, we tell select women.
Mm,
We have found those who we trust with these very special, hard things. But your story is gonna trickle through your circle, and I think that's what I love the most about the fertility awareness community is that matrescence journey, that story that follows you is gonna ripple out to some other mama, or that mama's gonna connect you to someone who needs you when they needed someone who's been through, "Oh, I know someone who went through that. Let me send her a message," and then you get to talk to this random stranger from, a country over who you maybe never will meet, but they have the
yeah,
same diagnosis you did, and you haven't found anyone else yet, and that feels really validating. So you are your own advocate, you're your own biggest health advocate. That's true from puberty, that's true through fertility, that's true through menopause, and that's true for you towards your kids. Like, you are the biggest medical advocate, and no one can care as much as you do, and no one can know your body as well as you can.
absolutely. I think so too. It's so good. Where can people find you if they want to connect with you specifically?
Yeah, so you can find me, Cycle Coach Courtney, on Instagram. I'm on there as at Your Fertile Future, and I usually do 3 group classes a year, and love having people come in and just share their experience, no matter where you're at. But I love working with those ladies working towards their very first baby. That's my specialty, especially coming off birth control into pregnancy. That is such a special time, and I don't take it lightly to be a part of getting some of these babies Earthside. So if you are looking for any kind of cycle knowledge or support, at Your Fertile Future is where you can find me.
Awesome. Well, thanks so much for being here and chatting with me and sharing all your things. I think we could probably talk for days and days and days about this all. But thanks for sharing this hour with me. And I'll appreciate it. And everybody should follow Courtney and get all of her insight and resources from her Instagram. And I'll link that all in the show notes.
Thank you so much. I love chatting with you. Like you said, we could probably chat for days and days and days and a new topic all
Yeah.
the time. So
Yeah, for sure.
I just love sharing the space. Like you said, women talk. So this is exactly what
Yeah.
it's about.
This Absolutely, absolutely. It's been so good. All right. Thanks so much.
Thank you.
Thanks so much for being here today on the Cyclical Doula podcast. If this episode resonated with you, the most powerful thing that you can do is to share it. Send it to a friend, text it to your sister, forward it to that group chat. This is how conversations about our bodies start changing. Quietly, organically, woman to woman. If you are listening and thinking, okay, I want help applying this to my cycle, I offer free cycle clarity calls. It's a relaxed conversation over Zoom where we talk through your goals, your charting practices, and what kind of support that would actually make sense for you. You can book one at emma.com/free. And if you haven't already, make sure you're following or subscribe to the Cyclical Doula podcast so that you don't miss future episodes. And if you feel called to leave a rating or a review, it genuinely helps more women find this work. So thank you. You deserve to understand your body. You deserve to feel confident in your reproductive choices, and you don't have to figure it out alone. I'll see you next week. Thanks for being here.
Welcome to the space where cycles breathe, where the real raw life of a mama leads. From motherhood's highs to charting the low, your body's story is the start.